Good afternoon, everyone, and welcome to the Arizona State Office of Rural Health webinar series. Our State Office of Rural Health, aka SOAR, provides technical assistance to rural stakeholders to disseminate research findings, policy updates, best practices, and other rural health supports to statewide rural partners and stakeholders. This webinar is brought to you by the Arizona Center for Rural Health. Our mission is to improve the health and wellness of rural and underserved populations. This webinar was also made possible by our partners. Thank you to the Arizona Telemedicine Program and the Southwest Telehealth Resource Center. A special shout out to our behind the scenes, Jen, Chris, and Chris for helping us out today. As an attendee, your mic is muted. Please type your questions and responses to activities into the chat box. The webinar is being recorded. You should have received a prompt as you entered, and this will be available at our crh.arizona.edu website and at the southwesttrc.org websites posted here. My co-facilitator, Lena, is going to be plopping in websites into your chat. So thank you for that, Lena, just for everybody to have easy access. Today's session is on opioid overdose recognition and how to use naloxone to save someone's life. This training was created by community health workers and representatives for community health workers and representatives. Thank you to the Arizona Department of Health Services, the Arizona Community Health Workers Association, and other partners for their contributions to this work. The training is available by request in Spanish and via Zoom for organization-specific one-on-one online trainings. Please go to crh.arizona.edu/program/naloxone to request a training. Lena also posted that into your chat, so thanks again, Lena. My name is Elisa Padilla, and my pronouns are she, her, ella. I'm the Community Outreach Manager at the Arizona Center for Rural Health and Comprehensive Pain and Addiction Center. I've been working on access to care and substance use topics for the last 6 years. My co-facilitator is Lena Cameron, health educator from the Arizona Center for Rural Health. Her pronouns are she and her. Lena specializes in harm reduction and access to care and has been working on those topics with community members since 2018. Some examples of harm reduction include seatbelts, life jackets, and for today's purposes, naloxone, the opioid overdose reversal drug. There are some interactive components to this webinar. Please open up the crh.arizona.edu website shown here. You're going to download activity 2, which is called Fill in the Blank, and you're also going to download the workbook. I've included both of those as highlighted here in the red boxes. Everything on the website is yours to use and reference in case you want more information in English and Spanish. And I'll show you directly on the website and give everyone a minute to download the activities and the workbook. So once you get to the website, crh.arizona.edu/program/naloxone, you'll just scroll down to the training materials section and click on workbook. And this should open in a new link for you, easily available. The other item you're going to download also from that same website is in the activities section. So you just scroll down to the activities section, click on fill in the blank. And that should download an activity called Change the Language by Role Modeling. I'll give everybody a couple more seconds to download those to your computer. disclaimer, if you feel you need a minute alone, you're welcome to step away from the computer for some self-care. We recognize this topic can be very heavy. We're here to support you in your learning process. And I always like to say, you can only help others be okay if you're okay yourself. So self-care first is very important. Today, we will learn some definitions, go over the current opioid epidemic in Arizona, learn about the connection between trauma and substance use, and go over the risks for an opioid overdose, and learn how to recognize and respond to an opioid overdose. We will have a few activities to practice definitions, inclusive language, and how to respond to opioid overdose. One of our last activities will help you refer community members to resources in Arizona. At the end, we will define risk reduction messages that would be helpful for you in your practice. The workbook you downloaded is your tool for during and after this training, so feel free to use it. So we'd like to learn a bit more about who's here taking this training. So we're going to have Chris pop up the first poll question. You should see that on your screen. If your county is not listed, click Other, and we'll have you enter your county in the chat box. They only gave us 10 spots for 10 counties, but we have way more in Arizona. And if you're outside of Arizona, thank you for joining us. The resources are also available to you, but you might want to check with your state to see what applies. So everybody should be able to see the results. We've got a lot of people from Pima. We have a couple from our rural counties. Shout out to Graham County and Navajo. You're pretty well represented, and it looks like we've got someone from each county, so thank you. Now we'll go ahead and go into our second poll question. We'll give about 30 seconds for everybody to answer the second poll question. It looks like we've got a nice split, 50-50, between community health worker, representative, or community leader or member. Thank you, I appreciate it, Chris. And thank you everybody for responding. So we're going to continue with a brainstorm, and I'd like to hear about your thoughts and experiences with these topics. Please respond to the questions on the screen in your chat box. The 4 questions you've got are: what is an opioid? What have you heard about naloxone? And what concerns you about using naloxone? And the last one is: what are you experiencing in your community? And we've got a couple of responses coming in. In terms of what an opioid is, a morphine-like analgesic. Opioids are forms of pain relieving. Many of them are available by prescription. some individuals letting us know that they have lots of overdoses in their community. So we're very glad you're here today so you can learn more of this information and share it. Opioids are oftentimes prescriptions. Yes. Some concerns are that we have concerns about using a needle. So we'll talk through that and see what some of your options are. That naloxone has saved many lives. That's definitely happening. We have somebody say that they've seen someone administer Narcan or naloxone and that they were surprised at how quickly it works. So we'll go over some of these in our session today. So thank you for writing these down, and we'll bring them back up a little bit later. So opioids are pain medicine. Heroin and prescription opiates are called opioids because they bind to the opioid receptors in the brain. Prescription opiates include medications like Vicodin, Oxycontin, and Percocet, and can be prescribed by a doctor or taken illicitly. They increase pain tolerance, cause drowsiness, and can produce feelings of euphoria. Opioids can cause physical dependence, resulting in a painful and difficult withdrawal period if the person stops taking the opioids. All opioids carry a risk of causing overdose if too much is taken by causing respiratory failure. And as you can see on the screen, there's a whole list of different brand and generic names. Now we're going to work on that activity that you downloaded. It's the fill in the blank. And with this activity too, you're going to click on the view and edit to type directly in the Word document. So it should have downloaded to your downloads folder. And you're going to fill in the blank while we review the terms to use to support people together. So fear of judgment often stops people from seeking help. So it's important for us to use words that are kind, positive, and inclusive. This type of language reminds people that they are important community members. We as community advocates can role model positive behavior. So going down this list that you see here on the screen, instead of saying clean, you can say negative, like a negative test result, or not currently using substances, or sterile, like a sterile needle. Instead of saying dirty, you can say positive, like a positive test result, a person who is using substances, or not sterile, like a not sterile needle or used needle. And then the third item, instead of saying addict or alcoholic, which can both be very, very stigmatizing, we can say a person with a substance use disorder or a person who uses drugs. You might hear people who use drugs use some of these terms, and that's okay. It's our job to encourage people who don't use drugs, especially those in power, like a doctor or a loved one. It's our job to be mindful of the words that they use and encourage us to use the other terms listed on this page. So I'll give everybody a minute to type that into your document. So here are a few more terms you can use that are more positive. Instead of abuse, you can say drug use or opioid use disorder. Instead of saying ex-drug addict, you can say a person in recovery. So once you're all done copying these down, you actually can also read through page 6 in your workbook after the training, and you can use it as a tool for your work moving forward. And just as an FYI for everybody that might have missed the activity or don't have the workbook now, all the answers are for the activities in this training are in the back of the workbook. Addiction is not a moral failing. It is a chronic relapsing brain disease. It is a medical chronic disease, just like diabetes. And understanding the cause and terminology is helpful in reducing the stigma that keeps people from getting help. 45% of those diagnosed with substance use disorders will also be diagnosed with mental health disorders. It changes the way someone's brain functions and how it is structured. There are many things that can contribute to someone using drugs, including early experiences and hereditary, environmental, and social factors. Addiction is not a decision. It is a disease rooted in both individual and historical trauma. Historical trauma is the multi-generational trauma experienced by a specific cultural, racial, or ethnic group. Here are a few statistics to consider when we think about this. 1 in 15 veterans have a substance use disorder. 75% of women who entered treatment programs reported having experienced sexual abuse. Adverse childhood experiences, also known as ACEs, are factors that can impact someone's future substance use. There's a screening tool to see what your ACE score is. The higher the ACE score, the higher the likelihood of someone developing a substance use disorder. There are definite resiliency and protective factors that can help prevent and address ACEs. And everyone can take the ACEs questionnaire in your workbook on your own time. And there are tips to prevent and address ACEs in your workbook too. People respond to ACEs differently. Having adverse childhood experiences does not mean negative health outcomes are set in stone. There are things that can be done to either prevent or lessen the impact of ACEs that can allow people to adapt to adversity. Things like knowing what resources are out there for parents, such as rent assistance and parenting classes. Encouraging youth to get involved can also allow them to find community. Just one healthy, positive adult being present in a youth's life can make a huge difference. It's important for everyone to know the risk factors of overdose to teach our community what to look for. This is a harm reduction approach, just like telling someone to wear a seatbelt. People are at higher risk if they mix their drugs, like if Abuela mixes her wine with an opioid and benzodiazepine like Xanax. Someone can be at greater risk for an overdose if they purchase their substance or drug from an unknown dealer. Many are being laced with fentanyl, which can cause an immediate overdose. Fentanyl is a man-made opioid 50 times stronger than heroin and 100 times stronger than morphine. It can also be caused by low tolerance. If someone has been without drugs for a long time and then they use at the same level they used before, there are greater risks for an overdose, like if someone was recently released from jail or prison. If someone uses alone, or if they are suffering from other health problems such as a weak heart or HIV/AIDS, they're at greater risk for overdosing. So here are some signs of an opioid overdose. This will help you identify if someone is overdosing from an opioid or if naloxone will work to save their life. The person overdosing will not wake up. They will have blue or pale skin, lips, and nails, and their body will be very limp. Their heartbeat will be slow with irregular or absent breathing. They will likely make a gurgling or choking sound and have pinpoint pupils, like the image shown here. So we're going to watch a video to see how to identify and respond to an opioid overdose using two different types of naloxone or Narcan.
But how do you know if someone may be experiencing an opioid overdose? Overdose happens when someone takes more or stronger opioids than their body can manage, leading to respiratory depression or a suppressed urge to breathe. Some possible signs of an overdose include being unconscious or passed out, slower or stopped breathing, lips or fingernails turning blue or gray, depending on skin tone, making snoring or gurgling sounds, and in cases of fentanyl overdose, we've also heard of cases where people become extremely rigid or stiff. While it's rare for someone to die immediately from an overdose, it is important to respond quickly. When people survive, it's usually because someone was there to respond. Keep in mind, Someone who isn't overdosing may be drowsy or sedated, but they will respond to an external stimuli like a loud noise or a shake. So, what can you do if you're worried someone might be overdosing? First, check for responsiveness. The easiest way is to do a shake, shout, and rub. First, shake the individual as if you're trying to wake them from a deep sleep. Then shout,
"Hey, can you hear me?"
if the person does not respond to being shaken or shouted at, then do a sternal rub. Make a fist and rub it, applying some pressure on the person's sternum or breastbone for about 5 to 10 seconds. If the person responds, monitor them and keep naloxone ready. The person should not be left alone. If they don't respond, it's an emergency. The first thing you should do if someone doesn't respond to the sternal rub is call 911. It's important to have backup on the way. There can be complications, or the person might be having a different kind of medical emergency. With some exceptions, the 911 Good Samaritan law provides protection to someone overdosing or someone calling 911 to save a life, even if drugs are present. Next, give naloxone if you have it. Naloxone is available as a nasal spray or an injection. In this video, we'll provide instruction for the single-step Narcan nasal spray. Narcan comes in a blister pack like this. Peel the package to remove the device. Put the nozzle in either nostril until your fingers touch the bottom of the person's nose. Press the plunger firmly to release the dose into the person's nose. It's important not to test the device or press the plunger until the nozzle is in the person's nose. All the medication is dispensed once the plunger is pushed. Narcan can take 2 to 8 minutes to work, and sometimes more than one dose of naloxone is needed. If the person has not become responsive after 2 minutes, give a second dose. If you can, try using the other nostril this time. If you don't remember which one you used, don't worry, just give the second dose. Hopefully, after giving 1 or 2 doses of naloxone, the person will become responsive. If this happens, first, tell them what happened. They may be confused. Explain that they were overdosing and you gave them Narcan. If the person takes opioids regularly, they might experience withdrawal symptoms until the naloxone wears off. It's important to explain that naloxone lasts between 30 to 90 minutes and that using more drugs is unlikely to reduce withdrawal, but it could increase the risk for another overdose. Medical attention is important. Encourage the person to wait for the ambulance. The person who overdosed shouldn't be left alone for at least 3 hours, since another overdose is possible when the naloxone wears off. If a person doesn't become responsive right away, it's important to know about the recovery position. Place the person's arm or hand under their head. Tilt their head back slightly to open an airway. Bend the arm and leg that's furthest from the ground to prevent them from rolling on their stomach. In addition to calling for help and giving naloxone, you can also do CPR if you know how, or simply provide rescue breaths. Getting oxygen to an overdosing person might reduce serious complications and can keep a person alive until help arrives. In your kit, you will find a rescue breathing mask that can act as a shield between you and the other person. Place the person on their back, tilt their head back, and open their mouth. Place the face mask over their nose and mouth to create a barrier. Pinch the person's nose closed and give 2 regular breaths into the mouth. Continue with 1 breath every 5 seconds. Ensure that their chest is rising and not their stomach. Readjust if necessary. Let's wrap up by reviewing what you can do if you think someone might be overdosing. First, check for responsiveness. Shake, shout, and rub. If they don't respond, call 911. Backup is critical, especially in light of fentanyl in the drug supply. Next, give Narcan. Remember the simple steps. Peel, place, and press. Don't forget you have a second dose in case the person doesn't respond within 2 minutes. If the person wakes up, it's important to explain what happened and encourage them to go with the ambulance. It's important that they're not alone for at least 3 hours in case of another overdose. And don't forget the recovery position and rescue breathing are important tools in emergency response. You can review all of the information provided in this video, plus learn about.
So that was the nasal spray. And now we're going to do another video, and this is the injectable naloxone.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So you've called 911 and grabbed your naloxone. Now what? Injectable naloxone comes in a 1 milliliter single dose vial similar to this one, and it can be given intramuscularly in the patient's deltoid on their upper arm, their quadriceps on the outer aspect of their thigh, or their gluteal muscle on the upper portion of their backside. To prepare a dose, we'll first remove the plastic cap from the vial and grab your needle and syringe. Now, since we're injecting this medication, we want to try and keep the rubber cap and the tip of the needle clean, so avoid touching those as you prepare your dose. Remove the cap from your needle and insert it into the rubber stopper. Now you'll withdraw the full contents of the vial. There should be at least 1 milliliter of fluid and maybe slightly more due to overfill, but withdraw the full contents. Now we'll get rid of any bubbles by sharply tapping the syringe and removing any air so that we're left with 1 milliliter of liquid. Now your dose is ready for administration. Today I'll demonstrate how to give a dose of injectable naloxone in a patient's deltoid muscle. When giving an intramuscular injection, you'll first remove the patient's clothing to expose the skin. Feel for the bony edge of the patient's shoulder. Place 2 fingers beneath that, and the triangular area here is the deltoid muscle, and that's where you'll be giving the injection. If available, clean the area with an alcohol swab. Then, pinch the muscle to form a firm surface. Insert the needle at a 90-degree angle and inject the dose of medication. Remove the needle and dispose of it properly. Do not recap your needle. Now that the dose has been given, the patient should start to respond within 3 to 5 minutes. However, if they're not responding, it is safe to give a second dose of naloxone in an alternate injection site if you have another dose available. For more specific questions on how to locate an intramuscular injection site or how to choose the correct size needle, feel free to check in with your pharmacist or doctor.
So I'm going to pass the mic over to my co-facilitator, Lena.
Alrighty. Hello, everybody. If you can't hear me, feel free to put it in the chat and I can adjust my mic. I'm using a different setup today. Thank you. So the Good Samaritan Act was passed as part of the Arizona Opioid Epidemic Act to encourage people who encounter someone overdosing to call 911 and not be prosecuted for drug possession. Someone is considered a Good Samaritan if they were seeking medical help for someone who was overdosing, if drugs were discovered when medical help arrives. The same goes for the person who had overdosed. There are limits to this law, so do seek legal assistance for guidance on more questions. Someone can experience possible reactions after receiving naloxone. Their body might feel like they're going through withdrawals and are having an extremely painful flu. Give the individual space after you use naloxone on them. They may feel sick, throw up, or experience any of the side effects listed here. Withdrawal is very painful, So be gentle and say, you overdosed and we use naloxone. Take a second to breathe. It's important to stay with somebody once they wake up from an overdose because another overdose could happen. Remember that naloxone can last anywhere from 30 to 90 minutes. EMS can take them to the hospital, though the individual can refuse medical care. They might be uninsured or undocumented or have another reason why they might not want care. If they refuse medical care, someone should stay with them for several hours and keep them awake. Overdose is a very scary thing. Staying calm yourself is important. Sometimes it's the thing that encourages somebody to get treatment. Important to note that naloxone will not cause another overdose, and it does not work on overdoses from other substances. If someone is not overdosing on an opioid and you give them naloxone, naloxone won't cause any more negative impact. For example, if someone took cocaine cut with fentanyl and overdosed because of the fentanyl, naloxone would work. If there wasn't an overdose from fentanyl, naloxone wouldn't work. So in Arizona, we have a few statewide resources that everyone can use in their communities. Anyone can call the OR line or Arizona 911 for resource support. You can look up where to dump your drugs at dumpthedrugsaz.org. Anyone can look up behavioral health treatment providers on the SAMHSA website. And in case you need naloxone, free or reduced naloxone locations at spwaz.org/Arizona naloxone. All these resources are in your workbook for quick reference. In your chat, we posted the Arizona 211 website. Now, if everyone can click on the link, we can walk through the website better. So let me get that in here. It's in the chat. And so we're going to take a little bit to walk through that website together. Alrighty. So this first page shows you the different resources that Arizona 211 offers, from housing and shelter to employment and substance use disorder resources. Everyone please click on the substance use disorders tile on the bottom right of the screen. Elise is showing that right there. Click on the drug use disorder tab and outpatient treatment or any link you like. So let's see, outpatient treatment or any. So once you get here on the top left, you can click add a zip code to list by location. It's this yellow button up here. And you can search by any local zip code you'd like. So we're gonna add a Pima County one here. And then it'll sort what options are available for treatment or other resources in specific zip codes. So this is a great resource to get local supports, organizations, just super cool resource for all the resources. I think we're good. I don't see any questions in the chat. Yeah, so amazing resource. I think we're good to go, thank you. So Arizona 211 has the Crisis Response Network and Resiliency Arizona. They help people and communities recover from the effects of disasters and or pandemics, short-term interventions that provide emotional support, crisis counseling, and connection to community supports. Anyone in Arizona can dial 211 on their phones to get connected to the many resources our state has to offer. This includes free anonymous counseling to any Arizonan affected by increased mental stress as a result of the pandemic. Statewide providers are available for phone-based or in-person services depending on the individual's location and request. And there are also Spanish-speaking counselors available. There are translation services for other language needs as well that are available for free through all statewide providers. Services include brief educational supportive conversations, individual or family counseling sessions, or counseling. Dial 211 on your phone to get connected. So even with these resources, Getting help may not be as easy as it may seem, especially for our rural and underserved communities. There are limited treatment options, even with investments in behavioral health. Drug use is the #1 stigmatized issue in the world. A person ready to recognize and accept that disorder. Sometimes treatment or resources can be expensive and in a completely different city. Withdrawal can be very painful and scary, as can fear of being arrested or isolated from someone's social support network. These systems can be very hard to navigate, which is where you step in as community health workers, representatives, and members. Sometimes people fear losing jobs, their house, their relationships, and families because of how stigmatizing drug use is. A part of the journey is relapse and remission. It's a very normal part of any chronic disease. It can take years for someone to recognize and admit that they need and help. It is a lifelong journey, and relapse is part of the recovery process. Relapse is normal and common and has similar relapse rates to other chronic diseases like diabetes, asthma, and hypertension. Because we're talking about the most stigmatized topic in the world, we tend to hold people with a substance use disorder to a higher standard than people with diabetes, for example. Someone with diabetes can be really well controlled. Then they have a stressful experience that might trigger eating habits that increase their blood sugar. It's a similar experience for people who use drugs. Everyone in this training can offer support. Use motivational interviewing tools, like listening and kind of hearing what they have to say. Remember that we are not here to diagnose somebody. We are here to support and help them access care. Use person-first language. Remember that words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. Everyone here can offer harm reduction tips. Some examples are in your workbook for you to check after the training on page 27. It's called the Harm Reduction Tip Sheet. And we're going to go over it a little bit right now. So the main points of harm reduction for opioid use are, if someone's actively using drugs, 1, don't use alone. Go slow. Use a fentanyl test strip. Know how to recognize the symptoms of an overdose, like pinpoint pupils and a gurgling sound. Learn rescue breathing, and carry naloxone. So looking back at all this, are there any questions, things that we can clear up? We covered a lot today. I think someone asked about getting naloxone. Did we answer that pretty well? Let's see.
And we're scrolling through the chat as we speak.
Yeah, where can people get fentanyl testing strips? So sometimes your health department might have some. Otherwise, you can buy them on AdSafe, I think. But yeah, I think those are the two main ones. Or if you can connect to local harm reduction organizations, those are probably your best bet because they usually have some in stock.
So one of the comments from earlier was that sometimes people might be afraid to use naloxone and whether or not it's safe to use.
Yeah, for sure. So we hear a lot about concerns about using naloxone, but I think we mentioned it earlier before. So if you use naloxone and you're not overdosing from an opioid, it's not going to have any effect, but it's also not going to like make the situation worse. There's like some rare cases where people might have like an allergic reaction to it, but it's never really like serious. It's just mostly annoying. So like people ask about what if kids get into it and they mess with naloxone. If you're not overdosing from an opioid, there's no effect happening there.
And then going back to some of the parking lot items that we had from our brainstorm that somebody that we have on the call is from a tribal community, and they're really far from a local hospital, which is very common in our rural areas in Arizona. We're a huge state, and so we cover a lot of ground. So it would be very important to have naloxone at home or on your person. Sometimes people are putting it in their maybe purse or makeup bag of that sort, just to have it readily available. Particularly if you're working with people who use drugs, if you have family or friends who use drugs, just to have it on, and as well as maybe even teaching them some of these basics so that they have this information. And oftentimes it's a catalyst to show that you care, that you want them alive, and to give them the tools and the resources to know how to take care of themselves, as well as how to take care of their community and the people they might be with.
For sure. Thank you, Elisa.
I think we have a couple more messages in the chat.
Yeah,
There's a lot of them, so I'm trying to scroll through them.
I love it. This is my favorite part. I see one. Let's see. What about if naloxone is expired? Love that question. Still use it. It's going to be, the only thing is it's going to be like a little less effective maybe, but if that's all you have, use it. Sometimes people, yeah, like it's better than not using anything.
Yeah, there's still some research being out there, but that naloxone, even after many, many years, was still effective and useful. There was a resource shared in the chat, never use a loan hotline to call if a person is about to use a loan. A volunteer will stay on the phone, no judgment, and we'll get info on where the person is. The numbers are in the chat box, so thank you for sharing that. We will be sure to log that and add it to whatever resources we're able to add it to.
That's an excellent resource. Seeing one, is it the same usage for kids who overdose? Yeah. There's no, just use the whole thing, whether it's the Narcan spray or the injectable, just use the whole thing. It should be the same.
School nursing programs, oftentimes your county health departments in the state of Arizona are now becoming distribution sites for naloxone. Also, Sonoran Prevention Works can get you some as well. So both of those are resources to connect with. If you want to send either of us an email and we can try and connect you to your local resource as well, we'd be happy to work with you, especially if you're at schools. Several schools might have their own policies. So you might have to look locally to see what's okay to have on your person. But at the same time, a lot of schools are starting to support having their nurses or other teachers or officers or any of their leaders have naloxone on their person, or at least be trained how to use naloxone.
And I see one last thing what I want to address in the chat is I see, why do you say that relapse is okay? And it happens in the recovery process. It depends on the individual. Recovery looks different for everybody. But people are dealing with a lot, especially, right now with everything going on. And having harm reduction is all about meeting people where they're at. So whether they're actively using, whether they want to stop, whether they want to adjust how the quantity, it's all about making gradual positive steps. So I'd rather have someone relapse than unfortunately, overdose and then pass away. So between those two, it's a part of the recovery process. So I thank you for that comment. Sorry, Lisa, what was that?
It's a lifelong journey.
For sure.
Just like with diabetes, lifelong journey, do steps to take care of yourself, same concept. There was a question about how naloxone has to be stored. Lena, would you like to take that one?
Sure. So you want to keep your naloxone in a room temperature environment. It shouldn't get too hot. That's the main worry. It shouldn't get too hot, and it shouldn't be in direct light. So a lot of people put it in their kitchen cupboards if they're at home, or a purse. The only thing is I maybe wouldn't keep it in a car just because it gets really hot. So maybe it's just keeping it from extreme temperatures and like direct light all the time. Anywhere else is good.
And we have a wonderful comment in terms of the relapse is that smoking cessation takes 7 times to actually quit smoking. So if someone relapses on an opioid, it is no different. It's kind of like yo-yo dieting. So thank you for sharing that comment.
Yeah, great comments. Thank you, everybody. And I think I saw in the chat what temperature is too hot. Usually like 80, like the high 70s to 80s, that's a little too hot. So if you could keep it in like room temperature, like 75 degrees Fahrenheit, that's like perfect.
We're scrolling through. Any other comments on the parking lot?
These are some really good questions. So thank you, everybody. I love when we get a good amount of questions.
Yeah, and SPW does have naloxone and fentanyl test strips as well.
Yeah, they're great.
Anything else you're still unsure of before we move forward? All right, Lena, all you.
All righty. So the 3 key takeaways we want everyone to leave with is that people who use drugs are not bad people. They're just people. A substance use disorder is a chronic relapsing brain disease, and naloxone reverses an opioid overdose. So save a life and carry naloxone. Thank you, everyone. And I think we're gonna talk about our evaluations next. 1 second, getting that link for you. Okay. Let's see, sorry about that. So please do complete evaluations. We appreciate your time and we're here to answer any additional questions. I'm putting the link in the chat box right now, as soon as I get this to behave. Oop. Go up. Sorry about that. So here is the evaluation in the chat. Thank you for filling that out. Really helps us. And so we have our Arizona Rural Health Conference scheduled for June 15th and 16th in Flagstaff, Arizona, and online pending pandemic policies, best practices. Please save the date in your calendars either way. We look forward to seeing you there. Thank you for co-facilitating with me, and thank you to everyone attending today. If there are any last-minute comments, please type them now in the chat box. Elisa and I can be reached at the emails listed here. If you would like to schedule a virtual training for your staff, please go to crh.arizona.edu/programs/naloxone, that right there, and click request a training. The recording will be available in the next few weeks at the site listed at the middle of the slide. We greatly appreciate your time and commitment to improve the health and wellness of Arizona's rural and underserved populations. Thank you very much and enjoy your day.